West Nile virus by Wade Snedecor and Taylor Russell. West Nile virus is a disease that was originally observed in Africa but has more recently made its way to the United States. It is usually a mild disease, though sometimes it can become severe. The disease is passed to humans when they are bitten by a West Nile virus infected mosquito. In this presentation, we will discuss the origins of the disease, a description, symptoms, tests and treatment, and the status of the current outbreak. West Nile virus was first diagnosed in 1937 in Uganda in the eastern part of Africa. A woman was the first to have the disease isolated from her blood when she was infected. This first diagnosis was made near the Nile River to the west, which gave it its name. In 1999, the virus was somehow brought by a host to the United States, with the first case being reported in the state of New York. The virus quickly spread during that outbreak. Today, the virus has been seen virtually everywhere in America and much of the rest of the world. Currently, we're experiencing a large outbreak of West Nile virus. This will be discussed later.
West Nile virus belongs to the flavivirus family, which has relatives such as the yellow fever and hepatitis C. They are all characterized by enveloped single-stranded RNA. It is also known as an arbovirus because it is commonly transferred from arthropods like a tick or mosquito to humans. It is a positive sense single-stranded RNA virus, meaning once inside the host cell, it will release its genetic material, single-stranded RNA, and immediately begin using the host cell's ribosomes to create viral proteins, which are then assembled to create new viruses that spread throughout the host organism. An infected person may display symptoms such as abdominal pain, diarrhea, fever, headache, lack of appetite, muscle aches, nausea, rashes, sore throats, swollen lymph nodes, and vomiting. Treatments for the virus: most cases, roughly 80% of cases involving West Nile show no signs or symptoms. There are several ways to test for the virus. The methods that are least used are head CT scans or MRI. A complete blood count or a test of the cerebrospinal fluid can also be used. The most common and effective test is the test for the antibodies the body naturally creates to combat the disease. Treatment options are simple yet limited. West Nile is a virus, not a bacteria. Therefore, antibiotics will not be effective in curing the disease. The only treatment is to treat the individual's symptoms and allow the body to naturally fight off the virus via the immune system. While the majority of the cases do not cause serious symptoms or lasting effects, some cases, especially those involving high-risk demographics such as the elderly or young children, can lead to serious complications or even death.
A mosquito will first bite a bird that is infected with West Nile virus. That mosquito is then infected and has the potential to bite and infect humans. This cannot be transmitted from humans back to a new uninfected mosquito. Since this disease is spread through mosquitoes, the number of cases of West Nile rise and fall with the rise and fall of the activity of mosquitoes. Mosquitoes are most active during the summer months. During this time, they multiply and spread the disease. This spread becomes noticeable when the infected people begin to show up in doctor's offices in late August or early September. The amount of cases stays relatively high throughout the fall months. When winter sets in, the activity of mosquitoes drops off, and therefore the number of cases of West Nile declines. The United States is currently experiencing the largest outbreak of West Nile virus since the disease was first found here in 1999. During the month of August, the beginning of West Nile season, 1,118 cases of West Nile had been reported in 38 states. These cases have already caused 44 deaths. The outbreak is spread mostly in the South, with 75% of cases being reported in Texas, Mississippi, Louisiana, Oklahoma, and South Dakota, outlining the southern trend. The highest amount of cases during the month of August have been reported in Texas. Texas alone has had 586 confirmed cases with 21 deaths. More cases are being reported as the fall months continue on and should begin to decline as we approach winter and mosquito activity dies down.